The science room at the Rwanda Biomedical Center is used to gather data and analyze all information about health. Mohamed Semakula, a health scientific innovation analyst at RBC, explains how data is analyzed by specifically using the case of COVID-19 pandemic.
We usually look at the cases we have, if they are from within the country or abroad. We closely examine the relationship between the cases and their influences, and this provides information that helps in making decisions over travelers. And people also use our link to access results, and we have been using this technology so that people can be served.
Since the COVID-19 virus was first detected in Rwanda in March 2020, technology has been useful to health authorities to measure the relevant information and also closely monitor patients to help mitigate the spread of the pandemic. The head of the HIV and AIDS Disease Prevention and Control, Dr. Albert Tuyishime, has noted that the use of technology allows them to take action and monitor all activities based on the data collected.
I can name the screens that are there to help us monitor the temperature for everyone incoming, especially for travelers. But also we use robots to help us, again, monitor the temperature, but also in some of the infection prevention and control activities we had at that level. Secondly, we use technology in the testing or diagnosis of the COVID-19, whereby we have a system that is helping us collecting information and data for everyone who is tested. And from there, we can generate automatically a certificate to anyone who has been tested. So this allows us to have the data, but also consolidated information on people we are testing. Moving to the case management, we have two categories of patients. We have those who are at home, what we are calling home-based care. We have a system we are calling Welter system that is helping us communicate in real time with them so that we can know if they are developing symptoms or severe symptoms so that they can be supported immediately.
Regularly evolving technology has become an important part of people's lives, and they are getting used to it in no time. In fighting against the spread of the pandemic, a system has been put in place where people use the Irembo website to apply for different documents, and there is also various delivery services currently being used in buying and selling to avoid gatherings and paying in cash that may lead to the spread of the virus. People used to go to different local authorities for different services, but by using this website, they get access easily. This has helped in fighting against the spread of COVID-19. Comparing the number of people we started with and those we have today, there is an increase of 80%. Even though the numbers of infected people has raised, it has not affected our services. This means that people now understand the importance of such services, and we hope that even after this pandemic, people will continue to use our services. The head of Department of HIV and AIDS, Disease Prevention and Control, Dr. Albert Tuyishime, also points out that using this technology has been helpful in managing and dealing with this pandemic.
These technologies did help us in terms of having information in real time so that we can have informed decisions. That's one. Secondly, these technologies helped us to communicate with the general population, but also with other partners as well as the world in general, which are really key when you are dealing with a pandemic such as this COVID-19.
Besides using technology in testing and analyzing COVID-19 cases among local residents and people from outside the country, RBC also has a system where you can use *114# to access information on vaccination status as well as testing. Olive Nete, reporting for RTV News.